What's up, guys? Tay Stream, Ryan Muscle. We're over here at Orthopedic Hospital for my knee. Y'all can see I got the MRI right here. So finna see what's happening on that. Y'all know I'm dealing with the back. I told you I'm still dealing with the knee also, but we pushing, we keep things grinding, and we don't let nothing stop us. On time we stop us when we hit that ground, and y'all know what time it is then. Y'all stay tuned and see what the doctor gotta say. We'll get back with y'all. What's up, guys? We're back inside the office now. Y'all can see at the knee doctor. So y'all can see we're really here, man. I really be going through this. So when I tell y'all, man, pain and gains, y'all pay attention, cause it's real pain and gains. We ain't here to fool nobody. We ain't here to tell no stories. We ain't here to lie to you. We just giving you the honest to God truth. This is what you call pain and gain series, man. Y'all stay tuned with me. If you haven't subscribed, y'all subscribe to us because we're really doing it. Stay tuned. Pain is like right here now, inside, but between my back and what's going on, I can't tell really what's the crunching and popping, and then when I step on it, sometimes it give out. Y'all do this.
Looking at your MRI, there's a reason for all that. Number one, you've got a tear in the meniscus or cushion in the knee on the outside called the lateral meniscus. My bigger concern is you're wearing out your knee over there too.
That sucker, boy. I mean, I just telling my son I can't even rub it. It's
on the inside
hypersensitive.
Where the shin bone is called the tibial plateau. You've got an area where you're missing cartilage. So this is a knee. This is the meniscus on the outside. You tore the meniscus here, but on the shin bone right here where the blue is the cartilage, you have an area where you've got a 8 millimeter by 6 millimeter area of raw bone.
That's what I told you. That crunching and popping. It's so dropping me. That's what made me hit the ground.
What we need to do is a couple things. Number one, scope his knee with the 2 focals outpatient surgery, where we go in. It's about a 30-minute surgery. We go in, clean out the tear, remove any loose debris. But long term, that area of arthritis over here, I can't reverse that with the scope. I'm going to order a brace called an unloader brace. That it looks like a sports brace. It takes the pressure off this part of the knee to unload that.
I mean, you touch it, boy. You know what you talking about. I mean, it feel like it go all the way through my bone like a toothache.
So, do you have a family doc?
Yeah, I just started out with this other one, Dr. Nini.
Okay, but yeah, we need to get that knee scope, clean out that meniscus tear with the scope. He can put weight on after the scope. It's outpatient surgery, 2 focals, about 30 minutes of surgery. They'll give him a crutches or a walker if he doesn't already have one. And then afterwards, recovery time from that's about 6 weeks. In the meantime, I'm going to have him talk with the brace people and see about getting him a brace. That takes a couple weeks for that all to happen. They measure his leg, and then about 2-3 weeks later, he gets his brace, and they show him how to wear it. Hopefully by then we scope the knee, and he can start wearing the brace and starting to rehab that leg. But for your age, you're 48, 49, you got like a 70-year-old leg.
This is what causes all this and the deteriorating of the cartilages and everything in a human body in general in the human body.
Basically, it's like tread on a tire. Every time he's walked, run, jump, there's wear in the knee.
In the whole body. I mean,
but he may have damaged that knee as a kid. It's like a little chip in the wall over the years, just rubbing the wall.
Yeah,
that chip gets all the way, it gets bigger and bigger. That's
they wanted that.
man.
Golly.
So,
No.
we're getting an appointment set up to do the scope.
yeah, I'll have the girls get it set up.
For the 25th of February at Baylor Surgical Hospital.
I just left.
Yes,
I mean, going every 2
You have
weeks.
to go back on the 25th.
That's crazy.
Dr. Pepper is requesting lab work. You don't have to go back to your PCP, your primary care physician. You can actually do your lab work at the hospital.
Okay.
So they'll call you. You have to probably go like 14 days prior to your surgery to get the lab work done, or within those 14 days.
Yeah.
And then once you go in there, they'll let you know exactly what time you have to be there at the hospital for your surgery. Because I don't know. They rearrange his schedule all the time. So I don't have a time yet, but they'll let you know. Okay?